Dr. Don Funk here from Movement Medicine in Montrose, Colorado. I'm going to give you some golf tests and then some fixes for those tests if you can't perform the test. So the first test we're going to do is the pelvic tuck test. So that test is that we're in the address position, and can we move our pelvis forward and back without moving our feet or our shoulders. What that would look like from the side is this motion. And that's to check the mobility of this lower spine and the pelvis. Now, if you can't perform that exercise, follow along. Dr. Don here from Movement Medicine in Montrose, Colorado, and today we're going to talk about some specific golf tests that you can perform at home, and I'll even throw in how to correct this problem if you cannot perform the test. So the first test we're going to do is the pelvic tuck. So we should be in the address position, and can we move our pelvis forward and back without moving our feet or our shoulders? What that would look like from the side is like this. Kind of strange, I know, but moving your pelvis that way indicates how much flexibility you have in that lower back. And if you can't perform that test, watch. So if you're having trouble with the pelvic tuck test, there's a simple exercise for that called the pelvic tuck. And we're going to have our back flat, and we're going to keep this part of our back flat on the floor, and we're going to curl that pelvis up. What that does is engage this transverse abdominis muscle here, which is so important for preventing golf injuries because that muscle needs to fire before we move our arms or our legs. If it does not, then we risk injuring our spine. So you could do that pelvic tuck 3 or 4 times a day, 10 reps, and that's going to start to strengthen that muscle and give you some flexibility in that lower back. Thanks for watching.